Hi guys, I'm Dr. Gyaneshwari Raikar and welcome to my channel Newbie Docs, where we make medicine easy, clinical medicine. Well, today's case is our first case, I hope, in a series of cases of what we'll be discussing on this channel. Today's case is going to be ABG interpretation. Now, everyone out there has put up ABG videos and this one is one of them. If you find clarity with something else, that's very good. If not, I hope my video gives you some justice. So let's look into it. We have a 70-year-old man who comes into the clinic. We have a 70-year-old man who comes to the emergency department with history of shortness of breath and abdominal pain. He is a known hypertensive and known diabetic. His vitals are borderline stable. I'm not going to look into it, but we do a pH. But we do an ABG analysis. The pH is 7.2. Bicarbonate is 14. Carbon dioxide is 35 and oxygen is 80. Now, the first step in identifying the primary disorder is to understand where exactly to look. So you need to look at first the pH, right? When you look at the pH, you want to identify whether it's acidosis or alkalosis. Now, pH is basically inverse of hydrogen ions, and we know that high amounts of hydrogen ions would mean the pH will drop low, right? So when the pH is lower than normal, then you're going to call it acidosis. When the pH is higher than normal, then you're going to call it alkalosis, right? Now, the second value you want to look at is your bicarb. Now, if the cause is metabolic, in this case metabolic acidosis, the bicarb will drop below normal. Why? Because bicarb is essentially trying to neutralize all the hydrogen that it gets to make the acid lower. And that is why it starts decreasing in value. In our case, bicarb is lower, so at this point of time our diagnosis is metabolic acidosis. But we have to do step number 3. Step number 3 is looking at carbon dioxide. Now, if we have metabolic acidosis, then carbon dioxide should be going out of the system again as compensation, so it should drop to lower values. In our case, it is borderline, which is 35. Okay. Now, a key thing to remember here is this person is short of breath. And whenever somebody comes with a respiratory symptom, you have to see if there is respiratory failure happening. Now, in our case, his oxygen is fine. It's 80. It's not ideal, but it's still fine. And he's not in respiratory failure type 1 or type 2 for that matter, right? So our primary diagnosis is metabolic acidosis. So I hope you liked this video. Stay tuned for more videos posted on this channel. I'll see you in my next video. Ciao.